Assalamualaikum warahmatullahi wabarakatuh. It's me Nur Akila Media Hazali, your presenter. So do you know what is aortic aneurysms? So let's take a look at this aortic aneurysm pathology. Patient need to fast from food 3 hours prior. During the examination day, patient is placed on the examination table. Usually, the patient has already set the IV line before entering the CT room. ECG LEDs are then connected to patient body and then positioned on the examination table. The patient is then centered at the nipple for abdominal aortic aneurysms. The contrast media is connected to automatic injection pump, and then the scan is performed. The imaging modality chosen to diagnose this pathology is computed tomography angiography, which is CTA. CTA also provides excellent high-resolution image of the aorta to be able to diagnose them in such a fast manner. As you can see, the comparison between these three images from these different imaging modalities showing the greatest spatial resolution in CTA. Besides, CTA can accurately delineate the size and shape of the aneurysm. This is because the high sensitivity and the specificity that is close to 100%. The high sensitivity of CTA can give a detailed analysis of the extent of the aneurysmal disease by accurately detecting the size of the aneurysm. Next, let's take a look at the cost effectiveness. First, one is ultrasound. Ultrasound is a low-cost imaging and the screening price is reasonably lower than any other modality. This is because it has a wide availability and non-invasive nature. It can be accessible almost from all medical facilities. The second modality is CTA. So CTA has a higher cost than ultrasound but lower than MRA. Ibrahim et al. Have investigated the actual cost of CT scans in UK MMC, where it costs RM402. This one is MRA. MRA is very expensive compared to ultrasound and CTA, but it provides better branch vessel imaging than the other two modalities. Vascularity abnormalities can be evaluated when the images are reconstructed in multiple planes. So what is the pros and cons in detecting aortic aneurysms in every imaging modality? Firstly, ultrasound have pros that can be used in patients with contraindication to CT and MRA, for example, for claustrophobic patients. Furthermore, ultrasound beats other modality with it being radiation-free and it uses no ionizing radiation and only use sound wave. Ultrasound is also available in portable where it can be rapidly performed at the bedside, which is suitable for unstable patients and does not need transferring the patient to the other department. However, ultrasound also has unavoidable cons where it is highly operator dependent, which misdiagnosis may occur, which is also can lead to false alarm. Next, image quality is dependent on patient body habitus such as obese patient and bowel gas, where it can be cause difficulty in visualizing the aorta. Secondly, CTA also has a wide availability as nowadays almost all hospitals has provided CT scan for screening to diagnose a certain disease. So the cons for CT scan firstly is the radiation exposure to the patients. This ionizing radiation may cause a later effect on the patient. Besides, CTA require iodine contrast administration, which can be a risk for a patient with an allergic reaction when injected into the body. The iodinated contrast media used may also induce nephrotoxicity and cause acute renal failure. This modality is magnetic resonance angiography (MRA). The pros that this modality provides, firstly, is there is no radiation exposure used for imaging. This is because it uses strong magnetic field instead of radiation. Besides, the gadolinium-based contrast media used for this MRA has lower nephrotoxicity than iodinated-based contrast media. Next, MRA is a minimally invasive procedure where only contrast media is administered into the body intravenously. Lastly, MRA can reconstruct the image in three-dimensional volume rendering into a specific cross-sectional view. One of the cons of MRA is limited availability. Even though the capability of demonstrating aorta in diagnosing aortic aneurysm is immaculate, it is only available in a big hospital. MRA also has a con where it has low temporal and spatial resolution compared to angiography itself, where MRA may not detect the subtle stenosis and wall irregularity. Besides, it also has long acquisition time, which is why it is seldom used in the emergency state due to the need of rapid diagnosis and the patient in a critical condition. So the radiograph shows normal thoracic aorta with diameter size less than 3 cm. The thoracic aortic aneurysms in 3-dimension reconstruction and CTA, the ascending aorta is seen has increased in size with 50 mm 4 years before administration, which can be diagnosed as a thoracic aortic aneurysm. Next, let's take a look at the normal abdominal aorta, where the aorta size usually less than 3 cm. Looking at the ascending aorta, the size has already greater than 3 cm, which can be first indication for abdominal aortic aneurysm. The flowing of contrast in the ascending aorta with dilatation of the lumen where the posterior aortic wall follow the contour of the vertebral body is called as a draping effect. So, in conclusion, CT scan has been chosen as the gold standard modality due to its balance, advantage and disadvantages that are able to give very accurate diagnosis of aortic aneurysm compared to the other modality. That's all for me. Thank you.